can take off the headphones.
Yeah,
now.
we can take off the headphones. I'm on control of the cameras.
Uh-oh.
Yeah, and we have a special visitor today.
We do. Welcome. First of all, welcome back, dude.
Thank you.
It's so nice to have you here in person.
I smell good, don't I?
You smell really good.
Yeah, it's a man's butt. I just did no-gi.
Oh.
So literally, I smell like man's butt.
Yeah. Okay, we'll talk about that later.
Heck yeah, we will.
Once again, we have my very talented wife, Carrie, here. Dr. Carrie Hardy, also Brazilian Jiu-Jitsu black belt. And this is a perfect time for her to be here because we have some cool topics.
In which way is she talented?
Holy cow, we don't have that much time.
Oh,
on the
okay.
podcast.
What a dorky answer that is.
It's true, and it's a nice
Food.
Yeah.
You like the food?
Oh yeah.
When you actually take the time to try it?
Yeah.
Putting all kinds of shit on it?
You're gonna have to learn how to pass the microphone.
I will, but I didn't want to on that case because she's insulting me. We'll pass it here in a minute.
That makes sense.
Yeah.
So we do have a topic at hand. Our good friend, Dr. Mike Israetel, I believe, is back in the news. And I sent you guys I sent Chris a little article, and then I guess Carrie was like, I'm jumping in on that bitch.
It's exactly what.
And because it happens to be about TRT and BJJ people dying.
What's interesting, though, and we'll talk about that, is that article is misrepresenting what he actually said. So there's a little more nuance.
Okay, because I was ready to go off on our growth hormone gut friend.
I knew you would, but that's why we'll pull back a little bit because I want to make an important point about this kind of clickbaity title.
You're gonna ruin my day.
I will. But you had something else before we started.
Yes, I did. So we had a question actually come in, and I'm gonna play a video because they have an example that they would like to talk about. So the question is, can you ask Dr. Chris or Carrie about the trendy parasite cleanse that people are doing? Is it good to do or is it BS? And they said they'll send me a little video.
This is such a huge health concern that no one talks about, but we're going to talk briefly about it today. And we're going to talk about intestinal parasites. Millions and millions of you are living with intestinal parasites, and you have no idea. Many of you are living with...
So before Carrie gives, because she's actually the expert on this, before she gives an answer, just the video, you know it's legit because he's wearing a stethoscope over his scrubs.
Yeah, some people are professional, unlike you. So back to it.
Intestinal parasites and are experiencing symptoms, but don't know they're intestinal parasites. It comes from your food, from the chicken, the beef, fish. It comes from your contaminated water systems, the piping that the water is just coming through in your tap water is just despicably gross. It comes from the soil, comes from the environment. If you're living with them and you're experiencing symptoms, you may be experiencing anemia, brain fog, abdominal pain, bloating, fatigue, muscle weakness, joint pain, thinning hair and nails, and many more things.
Blue flames?
3 things that you can take to help kill the intestinal parasites are going to be clove, wormwood, and black walnut hull. And the reason why these 3 combined together have merit is because some of these are going to kill the larvae and the adults, and the other is going to kill the eggs. You can't just kill one, because then if you kill the adults, the eggs will hatch, turn into adults, make more eggs. You just kill the eggs, then the adults are going to lay more eggs, and then you are going to be continuously living with these parasites. I'll put more information down below. But
Don't care, buddy. What do you say?
Well, first of all, although the scrubs and the stethoscope, full points.
In a Tesla.
Well, we were in a car, so dude, get into your freaking office if you're going to do a professional video, or at least look someplace that's professional. But, and the herbs that he mentioned, the cloves, wormwood, the black walnut, yes, those are known antiviral, antiparasitic, antibacterial, antifungal agents, but are we really riddled with parasites? So we, as medicine in large and in science, don't really understand the full scope of the gut microbiome. We have some natural fungus, we have some natural bacteria, we have some natural viruses, and we have some natural parasites. Are they causing an issue? Most likely not for most people. Now, if you have some of the abdominal issues, like gas, bloating, etc., doing a test may not necessarily be a bad idea.
Sounds like when I eat ice cream, to be honest.
But you're also R-worded and don't listen to your body when you shouldn't be eating those things.
So does the testing like ova and parasites, is that what you run?
Yeah. So a straight ova and parasite test looking at your poo from 3 separate days.
3 separate angles.
3 separate angles, yep.
And days.
Okay. And so just to say that you're riddled with parasites and you need to get rid of them, well, we don't know what they're doing in our body that may be beneficial.
Are you like when you say you're looking at your poo? Can you see like little larvae,
For
parasites?
some of the bigger things, for sure, but the little eggs, no, you're not going to see that. Yeah, and so don't just take those herbs to take herbs, right? That's like taking medicine that you don't need. And if you have anemia, it's probably from other sources, unless, of course, you've been someplace where you've gotten malaria. Then you could certainly get some anemia, but that would be a known exposure, right? And we would be monitoring for that. But I don't think we all need to just go through a parasite cleanse.
Right.
I think that's ridiculous.
Right. It's just a little excessive.
Well, it's somebody trying to sell a freaking supplement. So
some wormwood,
wormwood
supplement.
So you can get like the Tesla truck, the cyber truck.
Yeah.
Like, easy, bro.
Actually,
We're not paying for that for you.
No, he wasn't in one. Okay, well that makes sense. So, our friend that sent that in, shut your mouth.
Well, I mean,
That's all I'm saying.
If you want a loose beehole, then go ahead and just start, using herbs that you don't necessarily need.
Yeah. Sometimes a loose beehole is good for you. Right?
Yep.
Yeah, how'd I follow that?
Yeah,
Right.
I mean, you can't really.
No.
So, on to the main subject, the title of the video.
Was it a video or it was the...
Oh, it was an article.
It was an article.
It was an article I saw on a jiu-jitsu site, the BJJ Eastern Europe, which is kind of a fairly popular website. And the title was just, it had Dr. Mike Israetel right there, new black belt, so he's in the community. And some people know my opinion on the guy. I'm not a huge fan of him, but that's just because he intentionally like says things in an inflammatory way and in a very like matter-of-fact way, and I hate when people do that. But the title is Considering TRT, BJJ black belt and exercise scientist reveals how PEDs can take years off your life.
Okay.
That's the title. So as most people do, they read that and they're like, oh, Israetel thinks TRT and stuff like that gives you cancer. And then the photos are amazing because
I saw
it's like
people in the hospital.
Yeah, I don't know if you can see it's you can't really see it, but it's
it.
Gordon Ryan sitting in a hospital bed looking like he's dying. Same with Wagner looking like he's dying. And
so shame on the person that wrote the article. So
let's call them out. What's your name?
I looked. I couldn't find it readily.
Oh, those assholes.
Yeah, you may be able to find it. The thing is, they did summarize a couple key points when Dr. Mike was on Chris Williamson's podcast. Now,
Okay.
I have not listened to that entire podcast, so I couldn't tell you the extent of what he said. But go ahead and read those summary points there.
So are these?
Yeah, he brought. There's some summary points right. Yep, right there.
Okay, so it says the science, PEDs, and longevity. It says Dr. Mike Israetel is a BJJ black belt and exercise scientist. Recently sat down with Chris Williamson to delve into health consequences of PED use. He outlined 3 critical mechanisms by which PEDs can impact longevity. 1, heart health. Quote, they're growing your heart muscle in a way that makes your heart worse at pumping blood. Dr. Israetel explained. This hypertrophy of the heart muscle can lead to inefficiencies and long-term cardiovascular issues.
Okay, let's stop right there.
Okay.
That is correct. Okay?
Okay.
That's absolutely correct. And
Okay.
then I'll read the second one.
Then we have number 2, cholesterol and arteries. Quote, They are consistently presenting you with cholesterol levels that do nothing good for your arteries. He noted, emphasizing the risks in arteriosclerosis.
Arteriosclerosis.
Yeah, good. You passed that test.
Thank you.
And other vascular conditions.
Okay. So, first of all, let's stop using cholesterol.
And
Okay? Let's just stop using it. It's
Okay.
lipoproteins, okay? The carriers of cholesterol, the things that are problematic, like we talked about, what was it, episode 10 or 9?
something like that, yeah.
Yeah, we had a whole, if you guys want to go back, watch it on video, because we did a whole bunch of visual stuff about talking about lipoproteins and cholesterol and what it really means. Anyway, I'll give him a pass on that. He's just trying to talk to the lay public, and I get that.
Okay.
So for steroid use and anabolic steroid use, that also can be true. Okay, so third point.
Okay. Then we have elevated blood pressure. Chronic high blood pressure, another consequence of PED use, adds strain on the cardiovascular system, further compounding health risks.
So that is true too, through a mechanism through the renin-angiotensin system with anabolic steroids. Okay, so all three of those I do not disagree with.
Okay.
All right, it's a double negative, so I
Yeah.
agree with them. The problem is that's when it stops talking about what Mike Israetel said, and then the author goes and editorializes and starts talking about TRT and Wagner-Hoche. Those are completely different things, and this is where I have a problem with the article.
Okay.
So he talks about how, and I don't want you to read through there necessarily to the listeners here, but you guys can go read the article yourself. They talk about how, well, his long-term use of TRT, and Wagner also says, well, under the supervision of a clinician. So true testosterone replacement, physiologic doses. Here is the point. In toxicology, we talk about the poison is in the dose. The dose really matters, whether we're talking about hormone replacement or anything else.
Remdesivir.
There's a point where when you go from physiologic, meaning replacement therapy is as we age, as we know, we've talked about this so many times, it's getting our levels back up to what they were when we were 30, which is our peak testosterone time. Usually we fall off about 1 to 2% per year in males after age 30, believe it or not. And so we're replacing those back to physiologic ranges, anyway, to what ranges in a young, healthy male would be considered normal. Not supraphysiologic, where we're getting them well beyond those ranges where they start so when we talk about anabolic steroids, we're talking about doses and actions on the androgen receptors that are well above what we would ever see normally, even in our peak young adulthood. Okay? That's the key distinguishing point, because let's talk about testosterone. It's a steroid hormone. So is estrogen. So are all the other hormones. They have a steroid background. Steroid is just a name for a specific structure in biochemistry. Cholesterol, sterol, the end of it. That's the backbone that we make all this stuff is from cholesterol. So DHEA, all those things, Carrie can name them, pregnenolone, all those things have the same backbone of the steroid. So anabolic just means building. A testosterone, by chemical definition, is an anabolic steroid hormone. The things that when people talk about steroids, they're talking about these synthetic type of things or things that are not produced by the human body that have actions on the androgen receptors well above what we'd see in normal physiology. So when this article starts talking about, first, Mike Israetel correctly states all those things. And by the way, I have a really good paper I'm going to reference that backs him up on all that stuff. And I can explain a little bit why in a minute. But then the author of the article then starts talking about TRT. That is completely different. And anybody reading that is like, oh, well, I guess I'm not going to take TRT then.
Well,
so
I will have people ask if I'm on TRT, and then they immediately, especially at like the new gyms, they will immediately lump it in with steroids.
Have them listen to this podcast,
okay?
Because it's got to stop, because it's a public health issue. There are guys, I'm 55, we're all, we're as we drop off, replacing testosterone has incredible benefits. matter of fact, not only are they not harmful, but they increase bone mass. They will actually help with dyslipidemia, what we call these dysregulations of cholesterol. I'm talking about replacement doses to physiologic doses. They actually will improve heart health through a variety of mechanisms, well-being, sexual libido, muscle mass, all those things, the diseases of aging, that improves. Matter of fact, what's really important is that there's a study that just came out called the Traverse study that was just completed in late 2023 that was published. They took a bunch of people from 45 to 80 years old, and these were people that had low testosterone, and they also had known heart disease or high risk factors for heart disease. Maybe they're smokers, maybe they had dyslipidemia, they had all these things, high blood pressure. So these are people at risk anyway. At the end of the trial, even in that high-risk population, there was no increased risk of replacing testosterone in those patients. And that's a key point because those are the most at risk for developing heart disease, and they didn't show a worsening cardiac endpoint with those patients of replacing. And you get all the benefits out of it, okay? So that's the point here. And what I'm going to do is kind of give my little overview and just talk about this paper. Then I'm going to pass it to Carrie, who actually clinically has developed expertise by treating hundreds of patients. Where I don't have that background of actually treating day in and day out these real life patients. Okay.
I had a quick side question.
Yeah.
I cross-trained at a gym, and there was a fellow black belt. He's 55 years old, and he's been on TRT for a year. And he was talking about how he doesn't feel like he sees the benefits that a lot of his friends that are on TRT has. He's like, I don't look jacked or anything like that. He's like, my recovery's better. And he had like one other thing that he said felt a little bit better. And he's like, other than that, I don't I don't see the benefits or difference. And I go, well, just so you know, if your recovery's better, that means your sleep's probably better. And it's actually doing more than you think. But yeah, you might not look like, someone that's in super shape or something like that, but that could be a ton of other factors in there.
And so the other thing is his provider listening to him, right? So everybody feels a little bit different at different doses, right? So some patients, like, once you get them up above 400, they're like, I'm good.
Right.
Even though there's room for us to expand if we wanted to, they feel good. Other people feel better in the 900 to 1100 range. And that's where they feel their best. But also, we can't just think that this one thing is going to magically fix everything, right? So if he's not getting the muscle definition that he wants, is he exercising like he should to get some of that?
Sure.
What's nutrition like? Sleep must be better. At least we can hope that it's better if he's recovering better. But there's all kinds of other things. This is just often starting people on hormone replacement therapy is that little gateway to them then getting other improvements in their life that build on this whole longevity health benefit thing. And that's, we'll get into a little bit more of that, but it's not a magic pill, and people need to fucking stop thinking like everything in medicine is this magic pill, right? So you still have to put some effort into your health.
Yeah.
Yeah, and I would agree with that. Also, his goal, I don't know, my goal is not to run around and get as jacked as I possibly can.
Sure.
A lot of the hypertrophy and the way we build muscle, there's a lot of genetic component with, myostatin type of mutations, and, however that gene is, there's a lot of factors, not just myostatin. But anyway, also, like Carrie's point was, maybe he's not optimized yet.
Right.
I don't know.
Only a year in, that's not that long.
It's not. And at 55, it's hard as hell for us to not only build more muscle, but to stop losing it. Right. And so that's the big thing about TRT is to stop losing it clinically anyway. But, if he was seeing someone like Carrie, we'd kind of look at where his levels are, take a lot, she asks a ton of questions, and then maybe, hey, let's nudge this up a little bit and see if we can get you even better.
Yeah.
optimized.
And I think also, for kind of just to echo what you guys are saying, is I was on TRT for years and I physically didn't look any different. I was still Fat Bill. It wasn't until I started doing jiu-jitsu and then still was the same. And then once I ramped up, whether it's jiu-jitsu or something else, I was working out essentially daily. And then weight started dropping off, even though I was eating like a turd still. But I was outworking my diet at that point. But I still hit a wall where that's probably where he's at. He's a 2nd degree black belt. He's trains very efficiently, I bet. You know, like he doesn't have to exert a lot of effort a lot of the time. And so, like what you guys are saying, how hard is he actually working out in these times? And then once I started cleaning up nutrition, stop eating so much fast food,
Plenty of protein.
Yep, I was getting the protein. I was nutrient timing, and then came quitting alcohol, and then it was like the composite body comp where leanness, muscle. That's when it started coming around.
This is interesting too. What about the delivery mechanism? Was he doing topical or is he doing injectable? Right?
Great point, because as we've talked about, I was topical until I met you guys.
Yeah.
I was always topical, and it sucked, especially because the doses I needed were a little bit higher. So I was just having to do the max topical amount, which was 3 pumps on each chest. And I know he's injecting because I also it was my way of prodding was, do they inject for you or do you? Because that could tell me if he's on a
topical or not.
Yeah, and if he's at one of those clinics that are
and how often is he injecting? You know what I mean? Is the timing like like we've kind of going down to
because at one point I was every 2 weeks.
Yeah, and we were like no,
and that was like, oh man, you're up and then down and then you're just all over the place. It kind of almost defeats the purpose of what we're trying to just keep me level.
Yeah, I do 3 times a week. Are you about
at 2?
You're at 2 times a week.
Yeah. I went to 1. That actually wasn't bad. I didn't mind that the 1, but after you told me that you switched to 3 and you just like having that, you just felt a little bit more even. Yeah, that's when I started experimenting.
And just
with
to
2.
be clear, everyone, you take the same dose that you take every 2 weeks, you just divide it up, right? I'm not doing like
it's
huge
not
doses.
0.8 of a syringe 3 days a week.
No,
then you might.
I'm doing like
start looking like Israel.
I'm looking like 0.2, right?
Yes. Yeah, or 0.3 or something.
Yeah,
whatever
just to kind of keep things going. Yeah, exactly. So
okay, so that's because he said he's going to start listening to the podcast.
But here, good, perfect.
Our brother in Vancouver, Washington.
And so I didn't watch Chris Williamson's podcast with him on it, but given what was summarized, I completely agree with Dr. Mike on that because it's all true. And I'll tell you what's interesting for those of you, please do not confuse. It's a pet peeve of mine. Everyone thinks TRT is steroids. It's replacement. It's not testosterone addition therapy. So you young kids that don't need to replace it and then are using it like a steroid, that's exactly what you're doing, right? So that's very, very different in the dosing. Now,
is there a difference in actual product?
What do you mean?
So, like stuff I get from the compound pharmacy, I think it just says testosterone on the bottle. The design now, obviously, we've heard of like Deca and Winnestrol and all that.
They're different molecules.
Okay, so these are different compounds.
They're different compounds that still have very high affinity to the androgen receptor, which is that's what testosterone binds to. Okay, so this is a really, really important point. People were like, "Yeah, steroids are fun." I'm not going to argue. People do what they want. I'm very libertarian. Just understand what you're doing.
Sure.
And don't rely on bro science. So, I have a paper, and I encourage you guys all that want to look at. There's a.
We'll put it in the description.
Yeah, steroids, but I'll just, it's in Frontiers of Cardiovascular Medicine, published 26 July 2023. The title is called Anabolic Androgenic Steroids and Cardiomyopathy. So we're going back to people that have had heart failure.
Okay. Which is the most common thing brought up is you're going to have some sort of heart failure or prostate cancer.
So first of all, the prostate cancer thing Carrie can talk about is nonsense. As a matter of fact, we've supplemented people with recovering from prostate cancer and during having prostate cancer.
And I know we've touched on it pretty much every TRT episode, but it's just good to do because it's still out there.
They may even, Carrie can correct me if I'm wrong, but I think there's some speculation that actually normalizing testosterone levels is actually preventative, believe it or not, in formation of new prostate cancer, which is really interesting. So TRT will have cardioprotective effects that's good in physiologic doses as we age. Okay, I'm not talking about giving testosterone to young kids in their 20s that don't need it. Right. So anyway, but that cardiomyopathy and heart failure, it's really, I'm not going to do a ton of medical terms, but it's really important to understand what happens. So I was in the military all through my young life, and part of our physical, they do EKGs on us. I've never had a normal EKG, electrocardiogram.
That's where they put like the probe in your butt and like they have to get your heart rate. Like the urethra?
Yeah.
Are you impressed with that term?
Yeah, you guys are monsters. So
Excuse you.
It's the one where you put the leads on, you know. And
on your chest.
Yes, the electrical activity.
That's what Bruce Lee died of.
No, we did not. We're not talking about stimulatory things. We're talking about reading the electrical activity of the heart.
Okay.
Okay, you with me now, buddy? So mine always showed what was called athletic heart.
Okay,
that,
don't.
Not me. A lot of young athletes have this thing. Is my point. I'm not saying I'm not.
You're not trying to.
No, I'm not saying I'm cool because many people that have been lifelong athletes from childhood through will have in a slightly enlarged left ventricle. That's your big pumping part of the heart that goes out to circulation. Okay. So you have a little bigger, stronger, what we call myocardium. All that just means is the muscular wall of the heart is thickened and strong and can pump more. So on EKG, you'll see it a little enlarged. That's very different than an enlarged wall that is non-functional. And that's what happens with especially prolonged anabolic steroid use. The difference is when the steroids hit the heart muscle cells called the myocytes, usually for exercise and things like that strengthen the heart will actually make the cells grow and actually have functional heart muscle tissue to actually pump more. Okay. In this case, what happens is those muscles, we start getting fibrotic changes. In other words, like collagen deposition, and the the wall will enlarge, but not in functional cardiac muscle. It has this fibrotic change into it, which this Carrie says the stiffy. It makes the heart not pump well.
Okay.
And when you can't keep up with the demand of what you're doing, let's say you're walking upstairs or something, and that left ventricle can't pump enough oxygenated blood out to the brain, to everyone else in the body, that's when that's what heart failure means. And we measure heart failure a lot of times due to what's called an ejection fraction. So every time that left ventricle basically contracts, how much of what's in there is actually being put into circulation.
Is that when it starts doing like that quiver thing?
It's a little different.
Okay.
Yeah, that's an arrhythmia. So this is actually it cannot forcefully get it has a smaller and smaller fraction of the blood it's able to pump.
Okay.
And so then, people are just doing their normal activities they used to be able to do, and they just can't get enough blood.
They'll get lightheaded and all that.
And short of breath, the whole 9 yards. So that's really important, where physiologic testosterone replacement as men age is very different than this supra, meaning above physiologic levels of what steroid hormones and even testosterone supplemented inappropriately to those levels will do. They have almost an inverted effect where a smaller dose that's appropriate will be protective. And we see this so much in toxicology, where then larger doses can be toxic, right? And that's how we look at this. And so, that's why I'm kind of pissed at this clickbaity title when you have a lot of legit stuff that, I know you have your problems with Mike Israetel, but I mean, what he said is correct for steroids.
Well, I'm literally the guy that just read the title and then I sent it to you.
Yeah.
Because I saw Israetel's name. I saw the title and I go, Chris, we got to talk about this.
Yeah. And this is my point, where now we've editorialized this article, and now we started flipping. Okay, what was supposed to be about anabolic steroids now to TRT, which by definition is testosterone replacement. You don't replace something that's not lost.
Right.
So that's my 2 cents on all of that. Carrie, I'm gonna pass it over to her clinically so she can talk about all of this stuff.
So, as you guys switch the mics there, have you listened to any of the Chris Williams?
I haven't listened to that one in particular either, but certainly will take a listen to it to see what he has to say. And like Chris was saying, when they talk about anabolic steroids, they put it all together like it's the same thing. And so, yes, testosterone is a steroid hormone, as is estradiol, progesterone. The levels that you grew up with and when they really spiked when you were, going through puberty, they weren't killing you then. Why are they killing you now for replacing you back to something more normal? It's, again, those elevated levels. And then we get a lot of bro science, right, that goes on, particularly in like the weightlifting communities, et cetera, where they're starting to stack things, right? I wish I could remember. There was a podcast that I listened to because one of the guests was one of the better known folks in peptides. And he was the podcast host was going through everything that he takes. So he takes some testosterone, but he also takes some of these other SARMs with it, the selective androgen receptor modulators. And I'm like, that's a lot of shit.
To just be jabbing into you.
Stack on, trying to optimize things. And so those are the people that I believe are getting more of the damage, the bad cardiovascular outcomes, certainly the bad liver outcomes, for sure. And then when liver goes and heart goes, kidneys go. So it's a huge downward cascade.
So I want to make a comment on this. And the medical community has also been a barrier to this. So instead of having physicians staying current and understanding how to safely do hormone replacement, whether it's men or women, because women have the same kind of barriers because of some things that have persisted through the years based on bad research. You can go to your normal run-of-the-mill primary care doctor, and all of them are like, Carrie had a patient the other day said, well, that testosterone is going to kill you, the replacement. And so where are people supposed to go?
Right.
So part of the problem is then they start looking through other sources of information.
Bodybuilding.com.
They stop trusting their physicians, and I don't blame them. So we need people, actually, that's why Carrie's so valuable, because she'll have a patient come in whose physician refuses to prescribe them. And what I would like to ask Carrie comment on is, how do you, first of all, can you give me some general examples of what you faced with that type of thing and how you approach that with the patient that's already been basically fear-mongered by their other doctor?
Well, we have two different ways you guys have seen these also. Carrie has her own practice, so she gets patients that come in and say, I went and saw this urologist and this endocrinologist, and they said no, or my general physician said no. And then that's when you run across it. You work in more of a large, it's not a hospital. What's that? A clinic? Yeah, you're in that world, and so you see it literally daily with your coworkers that are spewing that garbage in the break room or something of that sort. And so it's like there's two different ways you guys are actually hearing of these stories, and it's really prominent, right?
Yeah. Well, what I will say, and Chris doesn't get the opportunity to see this, so some of the newer providers that are coming out, like, they're actually not just going with the old dogma. So
what do you mean provider?
So like the gynecologist or the new doctors that are coming out, nurse practitioners, PAs, they're actually getting better educated about the safety of actual hormone replacement in general.
Because he's probably working with more old
Well, you still,
tenured.
you still get some of the newer ones. Like he has a dinosaur that works there that just thinks that anybody that's not an MD or a DO is out bleeding chickens and reading bones.
Gotcha.
And so, but they also have a statue of Fauci on their desk. So I think that says a lot.
I was going to ask if that was his name, but yeah.
No. So, I mean, but there's some of the other ones that I'm really hopeful about because I have some of my patients coming back in when, like, let's say I've needed to send someone just for a follow-up because of a few concerns from hormone therapy, like, hey, I don't think this is anything, but please go see this specialist. And they'll come back and they're like, oh, no, and they're super happy that I'm on this, and they are appreciative of the forum. And so there are newer doctors that are coming out that are very much...
That's encouraging.
That are very much at least understanding that the old taboos, like hormones are going to kill you. I'm like, no, they're not.
Yeah.
And so, but when I do have someone where they've come to me and they've been like, well, but my doctor said, I'm like, well, I respectfully disagree. And if we want to talk about research, I'm more than happy to talk with this individual and we'll go paper for paper.
Mm-hmm.
And we'll show the safety behind all of this stuff that often has been long-standing safety. It's just then some other article will come out and suddenly it throws the paradigm off its schedule, and then they are trying to say, oh, see, this is harmful. Well, no, let's understand a little bit more about what's been going on. Like, are there other factors at play, right?
Carrie, you go to hormone conferences almost like every quarter.
Yeah.
So you're staying well up to date, and I think that's what's missing.
Yeah. So, so the hormone therapy in itself, and particularly this whole thing, because our mutual friend last week sent us that whole thing about a prominent BJJ practitioner that ended up in the hospital, but we don't know what all this individual was taking, right? Mm-hmm. And other things that play into that, like heart disease doesn't just set up in a vacuum for most people unless you were born with a defect or something, something going on, or an autoimmune condition, right? So getting a better understanding of their actual lifestyle, what else they're doing, and establishing a relationship so that patient doesn't feel ashamed to tell you what they're doing, so that you can safely prescribe these things for them is valuable, and you can't get that in a 15-minute appointment.
Yeah, that's a great point. So would you say, because one of the main people in the article that were used, the practitioners were BJJ practitioners, were Gordon Ryan and Wagner. I mean, two opposite ends of the spectrum, which is kind of odd to try to lump both them in. I mean, Wagner, complete assumptions. I would assume he is on an actual TRT dose, and maybe not. I mean,
and maybe something else with it that's undisclosed. And
then now, because he is 41, I think, right in there. And then you have Gordon Ryan in his 20s, had a massive transformation, and he's always been coy, and just more recently admitted fully that he's on some sort of steroid, and but he's always been coy about it. He's never fully rejected it, but he was always 160, 170 pounds. I think he's about 6'2"-ish, right in there. Very lean, thinner, and then he blew up. But with that, he started having a lot of medical issues. Now, we've seen so many YouTube videos, so many people pontificating that this guy is having these medical issues, which is a gut thing, is caused by his steroid use. Now, we're going to assume, let's just run with this, that he's not on a therapeutic TRT dose, that he is on some sort of...
Who are you talking about?
Gordon. Okay. That he's on some sort of cocktail, we would assume. So we're completely just throwing darts here a little bit. Could that PED use cause these stomach issues that he's going through?
So it seemed much more likely that it was that year of antibiotic use that caused the dysmotility, wrecked his gut microbiome.
Bring that up again, because Craig Jones also talked about that when they were at Henzo Gracie's, the Blue Basement, where the Danaher Death Squad started.
Yeah.
Go ahead and just briefly mention what that was.
Yeah, so he was getting MRSA like all the time because
monthly.
And he was on antibiotics, and that is awful for your gut flora. Matter of fact, it's basically destroying a lot of your what we call commensal flora that has a mutually beneficial. But we need that. It's an organ system. It is so important for our metabolism, for so many things, and it's intimately there with what's called the enteric nervous system, which is. The gut is often called the second brain because it has just as many nerve cells as the spinal cord does. Okay, so when you take antibiotics for basically a year, hardcore antibiotics to stop MRSA, which can be life-threatening, right? Likely because of a cleanliness issue, just the amount of people coming from all over the world training in that place.
Yeah.
I'm just assuming.
Well, what something Craig said was one of his theories of why is because it's a world-renowned gym with all these superstars that you can train with, and superstar coach John Danaher. And what happens is someone from Australia, Japan, the UK, Seattle, whatever, because the gym's in New York, they make this huge vacation that's built around a training vacation for a week or 2 weeks or whatever, and then they start to get a little something on their skin, and they're like, "What? I just spent at least $2,000 most likely, I would think, to do this trip. I can't just turn that away." So they just put a little tape on it, and then they hide it and show up.
Well, right, and that's a setup basically. There's a whole host of reasons probably why that was a hotbed for it.
Yeah, that could just be one part of it.
All this, and this is another thing. They show Gordon Ryan in the hospital. I'm just saying, it's another BS thing they did on the stupid article that I really don't like because of this. Because he wasn't in that hospital bed because of steroids. He had absolutely destroyed his gut, and like I said, it affects the nervous system of the gut too, which is responsible for motility, the way the gut contracts to move food through. Right?
Yeah.
And if that's not happening, he's talked about this very publicly, where this dysmotility of the gut is now he could barely eat without feeling nauseous because it wasn't moving, man. It's just like stuff sitting there.
It doesn't digest or something. Yeah.
Well, it's not moving through. You have a rhythmic contraction all along the gut to move things through. It's called peristalsis, and that basically wasn't happening. And it was almost certainly due to the antibiotic use and the gut destroying his gut flora, and not from the steroid use. But he's been very, very open recently about the steroid use for performance enhancing. Now, I want to make a really important point. Wagner, it says in that article that he says, yes, I've been on TRT under supervision of a doctor. Okay. And speculating any further than that is basically, it's not fair to him. And it's also defamatory to a point. If people are accusing someone of doing something, like Carrie said, there are a ton of other factors that could be coming into play with this. Just to saying that because he's on TRT, and then they're speculating, well, maybe he's on steroids too, or high TRT doses. That's all speculation. But I don't like how in the article they said, oh, well, he's been on TRT for testosterone replacement, so now that's why he's having this problem. Basically, it's inferring that. And I think that's bullshit.
What is the issue Wagner's going through?
He had heart failure.
Oh, wow. I didn't know that.
Yeah. So that's my point. So I'm not his doctor. I'm not privy to his medical records. I don't know his full medical history, and that's just speculation. But in there, they're inferring that it's his longstanding TRT use. I've been on TRT for 10 years now.
Same.
Yeah.
Actually, I've been on for I was 27 when I started.
I can tell
41 now.
I have
big math.
I have no.
Thank you.
My lipid panel looks perfect. I don't have high blood pressure. Because I'm using it under the supervision of my doctor, and I'm keeping it in physiologic ranges. And I couldn't be training now the way I'm training jiu-jitsu without replacing that.
Right.
And plus how I was feeling, my mood, the whole 9 yards, bone density, muscle mass, the whole things that causes aging and frailty. So that's why I'm so passionate about this, and I hate bullshit freaking articles like this that take something that Mike Israetel said that is absolutely true about long-term steroid use or supraphysiologic testosterone use, supraphysiologic, and then conflating that somehow with TRT is dangerous, because it's doing such a disservice to people that would be hugely benefited by TRT.
Right.
Anyway, and it's very safe. Go ahead. I'm sorry, Carrie. I didn't mean to take it that long.
Yeah. Welcome to the patriarchy.
You know, he wanted to make sure he mansplained. We're good. We're good. So, just to kind of touch also on things that they know about androgens, and so there's a huge review article about androgen misuse and abuse, and they go through about the whole history about androgens, and this is from 2021. You know, it was first discovered in the late 1930s. They had the first clinical use shortly thereafter. It actually won the Nobel, a researcher won the Nobel Prize for discovering testosterone in the late 1930s, and then it became a huge pharmacological commodity in the 1950s, was used a lot during World War II to try to keep people awake. And they go through and they talk about like what's normal use, and so physiological normal use, what's misuse, and they talk about ways that they're trying to, that they say is misuse, like andropause or low T, and I would respectfully disagree. Again, under a licensed provider who actually cares about you as an individual, and I'm not saying those testosterone clinics don't, but they are definitely making a buck rolling people through there every month to get their testosterone and their blood work and all of that. So may not be the best spot for you, but then the abuse more comes from the image enhancement, and using it as a physical enhancement tool, so for performance effects. What they do know, and the clinical status as to whether or not it's a proven therapy. So if for some reason you have bone marrow failure, so you're not making enough hemoglobin, red blood cells, testosterone is considered a second-line therapy. Bone loss is a second-line therapy for use in bone loss and osteoporosis. And if you have steroid-induced bone loss, so when we're talking about steroids, we got to think about everything that's a steroid, including corticosteroids, which are typically given for inflammation. That has a lot of negative side effects to it for prolonged use.
Is that like prednisone?
Prednisone, yep. Also, for like muscle building from like HIV, muscle wasting. Also,
Boots he had to deal with that, right?
He still is. And interesting, they said proven as a last resort for advanced breast cancer. So I thought that was really interesting. I didn't know those studies had come out. There's a provider who is doing some testing where she's actually implanting testosterone around a breast cancer site and is documenting the regression of that. I certainly wouldn't do that, but providing some of those women with testosterone helps them in so many ways, but it looks like it can also help with that breast cancer. I'm assuming so, yeah.
That what?
The estrogen sensitive breast cancers, like the HER2 positive breast cancers, yeah.
Because I feel like I've always heard that like testosterone will increase like cancer cells or something. I don't know, but like I've always just heard that it's linked. If let's say someone was diagnosed with cancer, like having higher testosterone can inflame it.
So, and
Or
they're
estrogen.
probably talking more about, well, if they're talking about like breast cancer, sure, there can be some conversion of that testosterone over to estrogen. That's typically normal physiological conversions, and not a lot of conversion over, unless you're carrying a lot of extra fatty tissue. And let's just be, honest about that. That fatty tissues, whatever, male or female, is converting that testosterone over to estradiol, and we've talked about that in previous podcasts. Yeah, the aromatase mechanism. Chris is chirping in the background.
Mansplaining.
Mansplaining.
I do like that you guys call it fatty, though.
Would you prefer adipose?
No, I think when you call someone a fatty, it like resonates more.
Okay, but that's usually just Mo.
I did not say that, Mo. I did not say that.
Mohammed Mustafa, Bill made me say that. And so
There's a gun under the table.
Exactly. And also then for the prostate cancer, so Chris brought that up, like testosterone therapy. So that's a little double-edged sword, and we've got to be careful. Not all prostate, just like not all breast cancer is the same, not all prostate cancer is the same. If it's the aggressive versions, they think that giving testosterone may not be or is not the best course of action, but if it's in the capsule, so if we think of the prostate like an orange, if it's inside the peel of the orange, the cancer, testosterone therapy may actually be really beneficial to reduce the inflammation of that prostate and kind of get it kicked back towards health. Now, if we've already gotten metastasis, where now we're finding cancer in like our bones or our brain or our liver, that's a bridge too far, and certainly not going to talk about testosterone therapy there for you.
But about testosterone causing prostate cancer, that's the point.
That's not been necessarily shown definitive that testosterone is causing prostate cancers. They think the low testosterone may be contributing to especially those non-aggressive ones that are still in the capsule.
Okay. Yeah, because that's kind of the opposite of what we've heard historically.
Yeah.
Not completely related, but kind of related. And I don't want to have us like get throttled, which we probably already will, just talking about this crap. But there's a delicious restaurant called Ivar's. Okay. Take the R out, and then there's a word called mectin. Put them together. There's a little drug that's very popular right now. And it seems like there's a lot of stuff like IVM, right? That is showing that it's helping. There's just a lot of content out there right now saying it's potentially helping with cancer.
Yep. So I forgot.
In a positive way.
Yeah. So the Frontline COVID Critical Care Alliance, and by the way, you keep the R in there. So R is
that's
constant.
true.
You're so pretty. Yeah. So anyways, so the Frontline COVID Critical Care Alliance, Paul Merrick, Pierre Corey, and the rest of those fabulous providers there, they've recently changed their name, which is not salient to today. However, they have on there a protocol where you could potentially support cancer therapies and using, and I'm just going to go ahead and say it, ivermectin as part of an adjunctive therapy, not necessarily as a cancer cure, because we can't obviously say that, but to help restore the body back to a healthy status, to see if that can be beneficial for them.
And I think Rogan just had like Dr. Gordon, or I think he just had one of them on to talk about the patients he's been prescribing and like keeping track of, and he's had like a lot of success. From what I remember with ivermectin, it helps with something with the cells expanding or multiplying, like it prevents it.
Yeah.
Nailed it.
Nailed it.
Kinda.
Yeah.
Keep the R in there.
Yeah,
Hard R.
It's a hard R
Wow.
in ivermectin.
So in my little chicken brain, that seems logical that if something is stopping the multiplying of bad cells, right, which would be cancer cells, right? Seems like that would naturally be a good thing.
But pharmaceutical companies,
Hey, ivermectin's kind of cheap.
how much are they going to make off of that?
Right.
Yeah.
And
So-
then we put the tinfoil hat on because then it's, well, they make our food cancerous to then give us prescription meds that are cancer defeating. Oh, my goodness.
So these are all really good things. We should be open without worrying about saying Voldemort
That's true.
to talk about these things because they are, like Carrie said, adjunctive to, like, you have a primary treatment with an oncologist, and there are other things we can do to support things that can actually help synergistically, like ketogenic diets, for example, in cancer. You know, many cancers are very glucose dependent, so that sets the metabolic stage because the metabolic part of cancer is huge. That's why diabetics have a hugely increased risk of all kinds of cancers just because of the state of the metabolism. So things, I'm just using an example.
Yeah.
So the keto is another, or keto diet, things like that are adjunctive therapies that may make what they're doing with your oncologist work so much better. This is, things like ivermectin, which has what we call pleiotropic effects in medicine. I mean, many types of one medicine can have many types of actions depending on the context, whether it's antiviral, antiparasitic. Because you got to remember, this medication, the guy won a Nobel Prize in medicine for this. It's the most prescribed medicine in
The horse paste.
the world. Yeah, exactly. But used for parasites. Then we were talking about that earlier question, specifically used for parasitic infections, right? So,
and this, a lot of the stuff that's been coming out recently, I just looked at Rogan. It's Dr. Mark Gordon was
he's a concussion specialist.
neurodegenerative medicine and treatment guy.
Exactly.
Traumatic brain injuries. But I think they talk about that
Sure.
piece. And I think they were combining ivermectin with something else. I don't know if you guys remember seeing that, but I can't remember what other drug.
And Carrie's been to. Didn't you go to Dr. Gordon's training?
No, I went to
One of his lectures.
I haven't done this training.
But my point is, we're physicians, and we need to stop. We need to stop being just like algorithm followers and actually have the responsibility to go outside and look. As long as the risk benefit supports it and you have informed consent, you should have that relationship with your patient to say, hey, look, there's some things out here that people are using. The risk is very low, and we need to have these individual conversations instead of marching lockstep because we're afraid of, this quote unquote standards of care, which are almost always pharmaceutically driven.
Which was going back to COVID and all that, that was like the big thing was people like you guys and multiple others couldn't even voice a different opinion or a challenged opinion to what the big narrative from whoever was, like, because you guys would get called quacks or maybe even attacked.
Well, not even that. So medical licensing, right? So I think California was probably one of the most aggressive ones.
I remember
to
those
try
two
to-
guys that
yeah.
like went to was that where they had to go in front of the council or something, and
They had
those
to
guys
go in front of the medical board, yeah.
those guys got crushed.
Yeah, and there's still, I believe it's Dr. Paul Merrick, like he's not allowed to sit for his boards anymore in his specialty medicine because he spoke out and was very pro ivermectin for the treatment of COVID-19.
Wow.
And so in Washington there was some rumblings, right? Like you can't prescribe this, like making it seem like not only if we didn't get the shots we would lose our job, or they would take away our license, but also that if you got caught prescribing this medication, you'd come under review.
Right.
And of course, under review by your peers, like there's people that are going to follow lockstep, and there's safety protocols for a reason, and I get that. It wasn't the Wild West out there, right? We had wonderful people that figured out a protocol for us to follow that was safe, right? And so the whole thing with the ivermectin was, oh, you're going to kill your liver. Don't do that. I'm like, really? Like, there's not been a dose to show that's been harmful for the liver. Now, the hydroxychloroquine, that was a different story, but the doses that were being tested were beyond what was needed for treatment.
And talk about liver. Let's look at the liver damage that acetaminophen, Tylenol, causes every year. Thousands of liver failure cases.
But, you know, so it just, there's good medicine out there. Unfortunately, for a lot of the patients, like, wanting to stay within that insurance model, and that's a whole nother discussion, you're not necessarily going to get outside of the box thinking, again, especially if you're going through corporate medicine, because I really feel bad for my peers in primary care. They're told how many patients they need to see per day. They have to keep up quota, don't get behind, all of this other stuff. And so they don't get a chance to sit down and figure out what's important for you, what else may be contributing to your health. And then, unfortunately, a lot of schools now are just pharmaceutical based. Like, you've got X, we're going to treat you with A. When you get side effects from A, we're going to go to B, C, and D. And it's death by pharmacy, right? Instead of some things like getting the baselines in health corrected, and then looking for those things like, oh, okay, well, you're borderline testosterone deficient, or you're perimenopausal, or, you know, you brought up Dr. Mark Gordon on Joe Rogan. So he's one of the big people that, working with our military folks, found out, like, oh, all of those small concussive events, or even a large concussive event, is really impacting the pituitary of the brain, which is causing a hormone deficiency. And so let's correct the hormones, and then sometimes these other therapies for correcting, like PTSD, fall into line perfectly well. So, you know, Mark Gordon's been a huge leader over the last 10, 15 years in concussive treatments, and his work is brilliant. It's just not well accepted by conventional medicine.
Right.
It's another big thing. I think hormone replacement and treating concussions especially is just, it's in the dark ages for some reason in medicine. I don't. It's starting to change because of guys like Dr. Gordon, but you know, it's been bad for a long time. There are certain conditions where, like, oh well, I guess hopefully it gets better on, you know, instead of like, yeah. So anyway.
So I guess to kind of wrap that TRT article, what's the main takeaway?
That working with a provider that's actually gonna listen to you, because there's gonna be some providers like, oh yeah, we can start you on some therapy, but no, you're already normal now. So normal meaning your blood work looks within that range of 264 to 916. You may be 300, but you still don't feel like yourself. So hopefully you can find a provider that listens to you and will help you escalate your dose as needed without driving it to the point of being in that super physiological range where we're starting to have problems. It's most things, almost everything in medicine can be done safely, as long as the person's going to continue to educate themselves, both the patient and the provider. Like, we all need to learn together and continue to improve. And the other thing is, you know, there's not a magic pill. There just isn't. So TRT is a tool to help you. Any of the hormone therapies is a tool to help you feel better, but you still got to put in the hard work, right? And then if you're one of those individuals where you're stacking other things on, make sure your provider knows so that we can do more detailed views, like, right? Like, do I need to do a coronary calcium score, which that isn't necessarily the best test, but that's what insurance will cover. Do I need to look at other panels on you to maybe assess cardiovascular health or liver health that's beyond the standard? So have an honest discussion. If you can't be honest with your provider, then find a new provider.
Okay.
my ending thing on this specifically to that article is, well, first of all, none of this that Carrie and I say is medical advice. Of course, we need to say that. We probably should have said that earlier. But just for information, you guys need to really find a doc that knows what they're doing with hormones and do it safely. The point I have again with this article is they conflated anabolic steroid use and supraphysiologic testosterone use with testosterone replacement therapy, and I think they did a big disservice in that, and they should probably correct that.
Yeah, I tried finding. I looked at a couple different articles, and I think they intentionally don't put a name of who wrote the article behind it. So it's
because then you got some people that are on the fence right now that probably could use TRT and work and have someone available to do it that really could benefit from it and do it safely. And then they see an article like that, and now they're going to, they may live years more feeling like crap.
Right.
Yeah. So it's a problem.
You guys got anything else?
Nope.
Can we talk about Ozempic a little bit maybe next time?
Oh, man.
Yeah.
I just have I know that this is kind of her.
It's her thing.
Her wheelhouse. It's so popular. And
well, any of the GLP-1s, not just Ozempic.
You're right, and it's maybe a little tinfoil hat in me or something, but I have some questions about it.
Let's do it.
Whenever something gets like really popular in the mainstream,
right?
I start to like,
and it is again like TRT. It is a tool to open that window for you to start making those other positive lifestyle changes that need to happen. And yeah, so it's great. I don't think everybody needs to be on it, and I'm certainly against pediatrics taking it. Just stop feeding those little fuckers.
Oh, like little fatties.
Yeah.
Okay. Well, grapplingwithpodcast at gmail.com. Hit us up on the comments in YouTube, comments on Instagram,
which I won't see any of them.
Chris will definitely not see those, but I will, and I'll bring them to him. DM us. That's it.
Later, folks.
Thanks, y'all.
Later.
Let's talk about pee-pee shots.